Okay, so next up, we have a friend who I'm really excited is able to join us today to share her perspective, Deborah Raji. Deborah is a Mozilla Fellow interested in algorithmic auditing. She also works closely with the Algorithmic Justice League initiative to highlight bias in deployed AI products. She has worked with Google's ethical AI team and has been a research fellow at the Partnership on AI and AI Now Institute at New York University, working on various projects to operationalize ethical considerations in ML engineering practice. Recently, she was named to Forbes 30 Under 30 and MIT Tech Review 35 Under 35 Innovators. We're pleased to have you, Deb. You can take it away now.
Hi, my name's Deborah Raji, and I'm here to talk about audits, engineering responsibility, and algorithmic accountability in healthcare. Some of you guys might recognize this bridge. This is the Quebec Bridge, one of the largest cantilever bridges in the world. And unfortunately, the location of one of the most tragic engineering failures in the world and tragic engineering incidents when on August 29th, 1907, the Quebec Bridge collapsed. And with it, sort of was and the process of that collapse. About 75 of the 86 construction workers that had reported to duty that day perished. And following this huge tragedy and catastrophe, interestingly, in the reports that came after, the retrospective reports that came up after, commissioned by um, the government, they found that one of the main causes for the collapse cited in the report was the engineer, the lead engineer of the project, Theodore Cooper, and his sort of lack of conscientiousness around his responsibility and obligations to the project. So he had been ignorant of safety protocols, he had made miscalculations in design, and as a result of that, he was sort of explicitly called out in this report as failing to fulfill his obligations as someone building this artifact to ensure the safety of those involved and to ensure that the bridge was built to a particular level of quality. And this concept of engineering responsibility is something that we've seen in other spaces as well. In the 1960s, the conversation about the Chevrolet Couvert and its steering mechanism, its very poor steering mechanism, which endangered the lives of a lot of people, was called out by Ralph Nader in the book Unsafe at Any Speed. And he talks again about this concept of those that create these artifacts, that build these systems, not having any sense of their responsibility with respect to due diligence in the development and the evaluation of these systems to ensure the safety and well-being of those that might be impacted by these systems. So this dynamic of engineering responsibility is something that we've sort of seen as a heartbeat throughout history. And we're seeing it today with this, with a bunch of these AI tools that are being deployed on the market, or algorithms that are being deployed. One example is with the Midas unemployment algorithm, where it was meant to be an algorithm to flag cases of unemployment fraud, and it was found that this was a very shoddily built system. It was, based off of missing and corrupt data. Anyone claiming insurance was sort of reframed as attempting to defraud, so the whole framing of the task was skewed, and as a result, over 30,000 cases were falsely flagged, and it led to at least one individual bankruptcy that's reported. So it was this highly consequential system that was just very shoddily and casually built, and demonstrates a lack of engineering responsibility awareness in the machine learning space as well. And you can kind of see that with self-driving cars as well. In the National Transportation Safety Board report, NTSB report on the fatal Uber self-driving car crash, it talks about sort of the lack of safety culture and the lack of safety awareness and safety features as part of the design of these products. And again, we sort of see an example from healthcare as well. Here's a great story about an algorithm that was used in Arkansas, Idaho, and Colorado to set the rates and determine the coverage of healthcare coverage of certain patients. and for Medicare and Medicaid, it was interesting to see one of the lawsuits in 2012 that had been brought up in Idaho as part of the court proceedings. They were able to analyze the system, and they found that it relied on really deeply flawed data that actually required the state to scrap the tool. And this only came up through litigation. So, one of the legal directors at the ACLU actually mentioned this. This product made mistakes at every step of the process. And everything truly went wrong with this kind of formula, which is sort of demonstrative of the fact that we're releasing these products of incredibly low quality. And once they're released in the world, they make mistakes or they ultimately collapse in the way the Quebec Bridge does, causing harm to a lot of people. If you think about the healthcare space, there's a couple examples of this. From IBM Watson's initial attempts being implemented for diagnosis in a way that ended up causing a lot of harm to, our the recent craze of COVID tools that weren't ultimately as helpful as advertised. And, in this article around AI-driven dermatology, and, it's kind of a well-known phenomenon at this point, the fact that it doesn't work very well for darker skinned patients. There's a Black dermatologist cited in that article, the dermatologist that actually wrote the study about the disparities of machine learning's performance for darker skinned patients. And he describes it well, where he says, part of the problem is that people are in such a rush. Folks see that, things have the potential to be useful. And as a result, they just want to jump into it without thinking about the clinical consequences. And as a result, we go after easy data sets and we neglect issues like bias. So he kind of paints the bias challenges as part of this broader pattern and broader culture of a lack of engineering responsibility that we see in AI and machine learning. So he kind of shapes that conversation as, a lot of what we're seeing with these failures, and especially and including these bias failures, are really this. It's like a car crash. These products are acting unpredictably in ways that actually cause a lot of harm. And it raises the question of, well, how do you hold people accountable for that? How can they, how is it possible that we as those that are impacted by the situation can demand the information that we need to judge those that have decision making power here, and do it in a way that's consequential? And this is really the definition that Waranga gave for accountability and how it applies in the context of algorithms, where those that are making decisions and those that are impacted by these decisions need to have a balance of power in order for systems to be held accountable. And outside of engineering responsibility, which has to do with those that built the algorithm, you can have other stakeholders playing that actor role that need to be held accountable. So if you think of engineering responsibility as sort of the obligations of the manufacturer of the car to ensure that there are brakes, to ensure that the steering system functions appropriately, then you can think of other forms, other stakeholders, and other forms of accountability. Operator accountability, for example, could be those making use of the algorithm. Think of it as a drunk driver or a reckless driver and the harm that can arise as a result of that. And then also there's issues of structural harms. The historical legacies and norms of society at large can cause a lot of issues for those impacted. Think of it as, the infrastructural issues of a bad road or a lack of lights along the road causing the potential for that car to crash. So, looking specifically at engineering responsibility, though, there's a lot of important questions here. So, the challenge of engineering responsibility is pretty much this question of how do we hold those building technological artifacts accountable for the ways in which it might hurt people. So, one strategy that we're currently deploying to do this is this idea of an audit. So there's sort of two types of audit. There's the internal audit and the external audit. So the internal audit are these internal responsible innovation teams and consultants like Accenture. They have direct access to the system. They have a contractual relationship with those conducting, with the audit target, and they're usually analyzing the system before it goes out the door. Sometimes there's post deployment monitoring as well, but they're very much engaged with the teams, internal teams involved in coordinating the deployment of these systems. And their focus is on compliance and quality control. They want to minimize liability for the audit target, and that's one of their goals. And enforce engineering responsibility in service of that. External audits are different. They're indirect and consumer level access systems, and have consumer level access to the system. And this includes maybe regulators like the National Institute of Standards and Technology or the FDA or the Government Accountability Office. It includes academics. It includes investigative journalists like the Markup, and it includes advocacy groups like the Algorithmic Justice League or the ACLU. And often they're looking at things post deployment, and they're sort of completely independent and completely focused on protecting represented groups. And external audits are things that have happened for a long time. There's a long history in regulation and in academia in particular in the HCI space of, externally looking from the outside and auditing a system. But there's sort of these recurrent issues in external auditing that have been really frustrating for the field for a long time. So for one, issue is the fact that the benchmarks or the evaluation data sets involved in testing these systems are inherently biased and unrepresentative sometimes of the communities that the auditor actually wants to assess the performance of the system for. The second issue is that it's very difficult to directly access the target. So usually you'll be trying to audit a particular feature. In this case, we want to audit the machine learning model specifically, but that might be wrapped around a larger product or a larger set of alternative features. And we want to isolate the system that we want to actually audit, which can be difficult. The third issue is around public pressure. It's very difficult to get people to care. Just because you audit something does not mean it actually piques the attention of the company that you're auditing. And that can be very, very tricky to navigate. And the last thing is this issue of hostile corporate reaction, where we're worried that companies can respond negatively. They will sue, they will get upset, they will deny claims, and that happens after you point out flaws and you audit these systems. So one question that we approached this whole situation with was, how can external algorithmic audits be designed to address these challenges and lead corporations to mitigate concerns? So, for one thing, we looked at other research communities and what was happening there in order to identify, how to address these issues in the algorithmic or AI space. So, one thing is we looked at anti-discrimination law and particularly the theory of intersectionality. Where Crenshaw talks about intentionality in the design of populations and analysis for discriminatory outcomes. And she talks about, build, and it sort of inspires us to build these benchmarks with a lot of intention. And then, to address the access to audit to target issue, we look at HCI online platform audit practice and adopt some models for how they are able to isolate targets and particularly select audits that are isolated. We look at the financial audit space to understand how they generate public pressure in those spaces. And in that case, they kind of introduced to us the strategy of publicly naming multiple targets to create this competitive dynamic and also garner media attention. And then this hostile corporate reaction challenge was sort of mitigated by looking at information security and how there's this strategy of coordinated vulnerability disclosure where those that release information about bugs in software systems and security loopholes have to communicate to the companies and give them a response period before communicating to the public. And we thought that was brilliant. We could do that for our audits as well. So the gender shades audit was really us looking at deployed commercial machine learning products that were claiming to identify, gender appearance based off of the face. And we thought, okay, well, how well does this product work for the communities that we care about? In our case, we were very interested in looking at this intersection between male and female subjects and the darker, lighter skin subjects. And we had developed this PPB pilot parliaments benchmark that was balanced with respect to representation and these two dimensions. And you can see here how PPB compares with respect to all the other face data sets at the time, which are skewed heavily lighter and heavily male. PPB is one of the only balanced data set, and that's in that lot, revealing the fact that it was just such a critical intervention to just introduce that benchmark. And once we had that benchmark, we were able to evaluate the performance according to that benchmark and see right away that this darker female subgroup was the performance on this darker female subgroup was incredibly subpar, much lower than for the lighter male subgroup. And after this result, the companies kind of responded right away. It was very clear that this was not an issue that had been brought to their attention previously, and they were all, declaring that, oh, we're so glad that you brought this up. Now we can change our engineering practices and we can adopt new evaluation procedures and change our ways pretty much. And after about a year, we're like, okay, well, let's see what happened and what changed. So within 7 months, the three audit targets of the initial gender shade study, Microsoft, Face++, and IBM, all released new versions of their APIs. So we were able to reevaluate them, and we found that they had made improvements specifically on the darker female, on performance on the darker female subgroup. So you can see here the change in Microsoft's performance, Face++ performance going from 65% accuracy to 95% accuracy in this darker female subgroup, and the IBM performance, even though they sort of have consistent performance for the lighter male subgroup. And what this provided was an interesting rebuttal to this kind of response that we were getting and seeing in the press around it's just harder to do this task for a darker skinned individual than a lighter skinned individual. This is a functional limitation of the technology. And because we had evidence of the fact that these companies were able to turn things around in terms of performance on this darker female subgroup in just 7 months, less than 7 months in some cases, it's clear that this is not actually a fundamental limitation issue, but an engineering responsibility issue. They had just not actually been testing and evaluate. It's possible. They had not been testing or evaluating on this particular demographic or looking at things with respect to performance for this underrepresented group previously, and it just required pointing out that lapse in judgment in order for that to become actively part of the process. However, we kind of also identified in that study the fact that the companies that had not been included in the initial audit, in this case, Amazon and Kairos, still had huge performance disparities for the darker female subgroup. They were still heavily underperforming for that subgroup. And that revealed the fact that culturally, industry wide, we still had not changed our ways and not become conscious to this problem. The National Institute of Standards and Technology actually took this work and integrated it into their regulatory standards for facial recognition evaluation. And they found something similar as well, where Asian and African American people were up to 100 times more likely to be misidentified than white men. Subsequent pilot audits also revealed a similar thing where, taking these facial recognition products and then evaluating them in the context in which they're deployed reveals these huge performance disparities. In the case of MTA, they found they were trying to use facial recognition to identify those that were speeding on the road, on the highway, and their pilot study had a 0% accuracy rate, meaning that the tool was incorrect 0% of the time when actually assessed in the field. And similarly, the Metropolitan Police was audited by Big Brother Watch UK, which is an advocacy group, and they took the exact same facial recognition system that the UK police was going to be using, and they evaluated it on the ground, and they found again sort of this very high error rate of 81%. So one of the challenges of auditing as an accountability strategy is that your targets will identify the fact that they're being audited, often after the release of an initial audit, and they will put up walls. So Kairos is a company that we audited in 2018, and immediately after the audit became public, they raised their minimum bar for engaging with their API to about $100 a month. And then if you click through to sort of get to the product, there's so many clauses in there about not being able to use that free, to use this kind of product for the purposes of auditing. At the same time, there's also corporate responses that are well-intentioned but miss the mark. So in response to the audit, these companies just want to be able to address the issues raised in the audit specifically. So, IBM, in response to our work, said, well, one of the issues here is that we're not evaluating or testing for we have underrepresented sort of minorities in our face data set. We should build a bigger data set and have it more diverse, and that's going to solve the problem. However, they did not necessarily address the full scope of the problem, and when they sourced these data sets, they didn't properly inform those that they were sourcing these images from. And there's no way to obtain, informed consent from people that just upload their pictures to Flickr, not thinking that they would be part of a facial recognition data set. Similarly, after we audited Face++, a similar Chinese company, CloudWalk, decided to diversify their data set by purchasing face data from the Zimbabwe government. So all these issues of exploitation, privacy, consent arises when people just blindly respond to the audit. The other challenge of auditing is that, it's very difficult to have broader impact than the scope of the audit. There's a very sort of narrow scope of impact where you can only really target a specific demographic group or prediction task or company. And as a result of that, you can only see improvement for that particular task or for that particular company. And we saw that with this project where, Microsoft made improvements for gender classification in ways that a company that we had not previously audited, such as Clarify, did not make such an improvement. But for age classification, the disparities between the lowest performing and best performing subgroup for something like Microsoft was still quite high, and that disparity sort of persisted in other tasks, such as smile detection. So the scope of the audit's impact is very unpredictable and quite narrow to the task or to the company or to the demographic groups you're auditing for. The other issue as well is that audits don't solve this challenge of discredited pseudoscience where you might have a facial recognition task claiming to predict personality or chronality or hireability, and these are just scientifically unfounded objectives, and that no evaluation is really going to be useful in rebutting that kind of pseudoscientific claim. So, outside of external audits, internal audits are another sort of strategy we have to be able to hold these systems accountable, and this time from the inside. So, an internal audit is sort of part of this three lines of defense model, where separate from the engineering evaluation process and financial control teams or security teams or quality assurance teams or legal teams, there's this internal audit team or individual that can kind of operate as this overseer or this systems level accountability mechanism where they can understand the high level internal and external expectations for the company or for the product in question, and then work through all these different teams to sort of piece together the broader narrative of what's happening with the product. And the current strategy for doing that in machine learning right now is just to write everything down, to try to track everything that's happening with respect to this model from all these different teams and all these different perspectives, and make it as legible as possible to as many internal stakeholders as possible in order to coordinate the responsibilities involved and the risks involved, and have some level of risk assurance. So, it started off with a lot of data documentation strategies that evolved into model reporting strategies. Model cards in particular was this very impactful intervention where you could see, the model details and important considerations and important evaluation procedures, and it kind of enforced a certain level of engineers to sort of engineering engagement and due diligence around communicating what was happening in the engineering decisions that they were making. And in addition to model cards, there's sort of this tradition of internal audit documentation coming from aerospace and finance and the medical device industry. And at Google, we kind of pulled all of these documents into this broader framework of internal accountability and internal auditing. And I don't have time to get into the details of this, but I highly suggest you check out this paper to sort of really understand how detailed you can get with respect to really mapping out the entire ecosystem of concerns with respect to a particular product and the models and the machine learning models involved. However, one of the drawbacks of internal auditing is the fact that you're still an employee, you're still contractually obligated to the audit target. So there's a limit to how much you can push back. And this is exactly what happened to Timnit Gebru, where she spoke up about issues she was seeing. But because she could only push for so much change. It ended up sort of resulting in conflict that pushed her out of the company. So outside of auditing, what else can happen in order to hold these systems accountable? Well, another strategy or another approach is that of regulation. And this was the exact response to our our audit work was, we had all these companies, Amazon and Microsoft in particular, releasing these blog posts in response to the audit saying, well, yeah, we actually support regulation. We want not just us, the target of these audits, to be held accountable, but we want the broader field to have restrictions and to have guidance on what the due diligence expectations are, what our engineering responsibility obligations are. And, that did happen, especially in the summer of 2019. There was this proliferation of statewide, federal, and municipal facial recognition bans and, facial recognition regulation to say, well, if your system is dysfunctional or if your system is causing harm in this way or violating privacy expectations in this way, then you cannot, here's restrictions or regulation as to how you can make use of that system. However, the challenges with regulation as an approach is that regulation is very slow. It takes a long time to execute, but also there's so many lobbyists influencing regulators. So many close ties that they have, so many ways in which they push for particular loopholes, and you can see that on every facial recognition bill in Congress. There's multiple Amazon lobbyists attached. And in the healthcare space, you have the FDA sort of playing this important regulatory role for intervention and dictating what happens with respect to evaluation and with respect to the due diligence best practices of those developing these tools. And it's a really interesting opportunity, in addition to sort of other federal agencies such as the FTC, such as insurance-related regulators such as CMS or NIST, that can actually enforce some level of expectation and industry-wide changes to sort of engineering responsibility practices. But outside of regulations and audits, we can also demand for recalls. So recall is this idea of saying defective or potentially unsafe goods do not deserve to be on the market. So, if something's not working or it's hurting people consistently, just get it off the market right away. And that can involve an outright ban to a self-return. It can be voluntary or mandated. The Consumer Product Safety Commission in the U.S. is very involved in that. If you think of the recall of cars or unsafe goods, it's this idea of if it doesn't work and it's hurting people, just you cannot sell it. And we actually saw that with facial recognition. So there's this evolution that happened, following the cries for policy and regulation that happened in, summer of 2019. The summer of 2020 with the George Floyd protests really prompted people to shift their thinking from, oh, we need policy sometime in the future, but we're going to continue selling the product while the policy development conversation is happening. And I'm going to send my lobbyists to Washington. The conversations very abruptly changed to, oh, these products are not suitable for deployment in high stakes context because they do not work. While the conversation is happening around concerns and around policy development, we are going to pull this product off of the market. And that happened with IBM, Amazon, and Microsoft. They all pulled their products out of the market, especially selling the sale to police departments. And it was really this voluntary recall that happened across that industry, which is really interesting to see. The challenge with voluntary recalls, though, is that they take a really long time. They take a lot of external advocacy to happen. They don't necessarily, even if it's a voluntary recall, it does not happen on its own. It took about 2 years of fighting to get Amazon to shift its position from refusing to quit selling their technology to considering a 1-year moratorium on the sale of their product to police. Granted, this moratorium has been extended indefinitely just this last, about a month ago. But it's still a lot of internal advocacy. More importantly than that is the reality that especially with voluntary recalls, the language is so vague and short that it allows for a lot of loopholes. In the case of Amazon, they implemented that moratorium on the use of recognition, their facial recognition product, which is part of their recognition package and their recognition API. However, they continue to sell their smart doorbells, the Ring doorbells, and the Ring has this surveillance capacity, and they have partnerships with about 400 police forces. As part of the footage review, they have facial recognition features integrated there. So, that language in the moratorium disguises a lot of what can happen afterwards. And this has always been the case with recalls. There's always this opportunity for loopholes. And in the healthcare space as well, we've seen some recalls. So with Stanford Medicine, they had an algorithm to assign vaccine and roll out vaccines, and through poor design of the algorithm, senior staff members were able to, to be put at the front of the line, and residents and lower level staff members who were in the hospitals at the time were deprioritized. And due to a lot of important on the ground advocacy, they decided, okay, this model is not working. We're scrapping it. We're pulling it completely out. And in response to that, they just created a sort of walk-in clinic, first come, first served, setting up appointments in order to distribute vaccines, and completely scrap the idea of an algorithm determining, who gets access. So, in conclusion, if machine learning doesn't work for everyone, it doesn't work at all. But more importantly, those that are in charge of its functionality, decision making actors here, have an obligation to minimize algorithmic harms and to be held accountable. If you think about the Quebec Bridge and my earlier story about the collapse, of the 75 construction workers that perished that day, 55 of them were Native Americans and were pulled from the local reserves. And it was a huge blow, tragic blow for that community. And that's always been the case, when these artifacts, these technological artifacts collapse, they collapse on minority populations, they collapse on young people, elderly, the disabled, those people of color, low income individuals, women, those with little agency and knowledge to protect themselves here. So that's the real challenge, is the fact that when these companies are not thoughtful and they do not pay attention to their responsibilities, the people that truly suffer from that are the most vulnerable aspect of our members of our population. Thank you.